Hello friends, good morning. Let's look at the topic of safety of medicines. Medicines are not safe. Actually, what has happened, because medicines are available everywhere, their usage has become very common, and because they look, small, they look colorful, designed, well designed, attractive, packed in nicely labeled glass bottles, plastic bottles, colorful bottles, and all these things. This all makes you feel that the medicines are a common thing, nice things, maybe safe also. So there is a normalization of this thing, trusting medicines blindly, considering that everyone is taking this, every doctor is prescribing, every village has a pharmacy. So medicines must be simple and safe and secure to use. But not so. Think about it. If they are safe, why do they need prescription? Medicines cannot be given without prescription. There is a law in all the countries, you know, where people are not supposed to buy the medicines without a prescription. Pharmacies are not supposed to give the medicines without the prescription. General stores, kirana stores, small shops like they do in our uh, country, they are not supposed to sell the medicines. Even when doctor is prescribing paracetamol, antacid, there are limits. He is supposed to maintain, recommended, FDA recommended, Food and Drug Administration recommended dosages, limits, combinations, and all those things. But most of the things have not crossed the limits. People have started self-prescribing, without bothering about the consequences. They go on taking medicines. The pharmacist, the medical store owner, you know, people go and ask him, I have a cold, I have throat pain, I have this, that, and all. And he gives a combination of medicines. The doctor gives medicines, and people use that prescription to buy the medicine again and again using same prescription. Actually, that prescription is not valid for second purchase. So we don't have any system to check this in our country. Similarly, if the doctor is angry when the patient comes second times asking for the same medicine, if the doctor is angry, the patient is changing the doctor. He is going to another doctor and telling him to give the prescription. So you see, this has become so common habit. Now, uh, let's look at some of the very commonly taken, medicines. Paracetamol, taken for fevers. When it's used long term, it causes liver damage, it causes kidney damage, it causes joint damage, it causes stomach damage leading to acidity, ulcers, and all. It reduces immunity. Looks very simple. Maftal spas. The girls are taking it during menstruation. It is starting, it is becoming a habit in teenagers to carry Maftal spas in their, purse, in their bag. So what happens eventually? Every month she is taking 1, 2, 3 pills so that she can go to classes, attend classes, easily write exams, study, you know, behave like a good girl every day by just taking the medicine and filling the period pain. So eventually she will be developing all these other issues, reproductive issues, hormonal issues, and all. Coming to antacids, antacids cause indigestion. Antacids cause, ranitidine is there, glycine is there. They cause rebound acidity, hyperacidity. If you take one pill today, you will need more pills tomorrow. they cause indigestion, gas, discomfort. In fact, ranitidine, one of the most commonly prescribed antacid, has been found to cause cancer. It also causes some nutritional deficiencies. And there are other drugs like metformin, which is the drug given for diabetes. It behaves like insulin. And what it does, long term, it causes bone loss, weakness, osteoporosis. It causes vitamin deficiencies, vitamin B12 deficiency. Similarly, antibiotics are there, ofloxacin, ciprofloxacin, namoxin, all these things. And when these are used, it leads to. I'm not talking about abuse or using it daily, or I'm talking about a single dose. Even when you take a single dose, these effects happen. See, the effect that can be sold in the market is called as effect. The effects that cannot be sold in the market and made money is called a side effect. But both are powerful. Both are happening at the same intensity in the body. They are not different. I studied pharmacology. Pharmacology is the science of drugs. Masters I did it. Then I went to Central Drug Research Institute for studying further about drugs. I was fascinated by drugs, medicines. There all kind of research were happening, from testing on cells to testing on rabbits, mice, rats, guinea pigs, monkeys, and preclinical. And clinical trials were also happening. So I found one very big thing that everyone is groaning is side effects. Nobody is talking about side effects, but the patient will suffer. Patient has to deal with side effects tomorrow, and tomorrow is going to come, right? So if you are taking medicine today, tomorrow you will be in big trouble. You are in big trouble, and that is what is happening nowadays. We are seeing the mother is taking medicines, the newborn is having diseases. The baby is taken to hospital regularly and it is not developing properly. It is not growing properly. It is again and again getting sick. And such baby is becoming very weak teenager. Memory loss, hormonal problems, growth issues, obesity, behavior problems, weakness, lack of focus, all those things. And so on it is going on. So you see what happens. These are the effects on the body that I am talking about. But there is something much bigger than this. The effect I wanted to tell you is something which even doctors, they don't realize this thing. When you take a painkiller, you get an instant relief. When you take an antibiotic, you get an instant relief. When you take an antacid, you get an instant relief. So it becomes, very desirable. You will start liking it. You will start demanding it, craving it, asking it, seeking it, chasing it, right? I'm talking about a layman who really don't know anything about the side effects, pharmacology, chemistry, how medicines work and all. Even doctor will start behaving like a layman when he takes a painkiller and the pain is reduced. He also starts liking it. So the very first thing that happens is dependence, right? You'll start demanding for medicines for every discomfort, every ill, every uneasiness, every sneeze, every headache, every scratch, every itch, right? So that is the first thing that happens. Second, as I already said, your body will start getting dependent on it. For example, when you take diabetes medicine, it acts like insulin. So your pancreas feels that it is working properly. It's getting it is producing enough insulin, because the tablet that is there, it is reaching into the blood, metformin, it is acting like insulin. So our pancreas start feeling that I am working correct. So it never heals, it never repairs, because it does not feel that it is weak. So all that kind of effects start happening in the body. And the very first effects happens is in the stomach. Every medicine we are taking and putting into stomach, our gut, these places starts altering. Their chemistry, physiology, activities start deviating. Then there is a pattern, development of pattern, like you have to take medicines after eating. If the doctor has told, or the shopkeeper or pharmacist has told, take it after food. So you will start eating for taking medicine. You may or may not be hungry, but because you have to take medicine, you want to go to work daily. So because it's morning 8 o'clock and you need to take medicine, you start eating at that time. And over a period of time, this becomes a eating routine. Irrespective of whether you are hungry or not, you will eat. And this becomes a huge problem for your body. Your body will be getting loaded with unnecessary nutrients, food, junk, it may end up in obesity, toxins, contamination, overload, acidity in the entire body, accumulation of metabolic waste, and all these things will happen. Next thing that happens is your entire day will start becoming, structured around taking medicine. Like you have to take antacid 1 hour before eating, this medicine after eating, one time, two times. So your entire day will be structured around this. This is 7 o'clock, now I have to take tea. This is 8 o'clock, now I have to eat it. So your entire life revolves around, the routine dictated by the medicine. If one person in the family gets dependent on medicine, entire family's task become, providing him medicine on time, daily, every day, maintaining the dose, all these things. So it becomes a habit of the family. Now, this temporary comfort, instant comfort, powerful relief given by medicine totally shuts your mind, switches off your mind, and makes you think that you are alright. You are not alright. You are sick. There is some error you are doing. Lifestyle error, dietary error, behavioral error, some error, stress. You are not working, not getting sunlight, whatever it is, right? But the medicines makes you feel that you are alright. Everything is absolutely alright. Your behaviors are fine, right? So what will happen? You will not bother about the errors you are doing. You will not care about the errors you are doing. You will continue your misbehaviors, wrong behaviors, and ultimately these will also lead to further complications, other diseases and all. So it makes you stupid, dumb, idiot. Your problems will continue. Then there are financial issues. As you eat medicines, depend on hospitals, your entire body, see, the stomach is getting affected, the medicine goes to blood, the liver is affected, kidney is affected, brain is affected, there will be memory loss. Whatever medicine you take in the long term, it leads to digestive effects. It damages your digestive system. It damages your liver. It damages your kidney. It leads to deficiencies. Whatever medicine you take in the long term, it is going to cause memory loss, right? It is going to cause bone damage, nerve damage, everything, everywhere. Every medicine affects everywhere. There is a cumulative effect. Scientists study, doctors know that what will happen with the overdose, what will happen if you take for 1 month, 2 months. No. That's something different story. Here patients are taking from 10 years, 5 years, 20 years. This cannot be studied in lab. So that you will end up with much severe serious consequences. So if kidney is affected, there is kidney stones, there is kidney damage, kidney failure, chronic kidney disease. If liver is affected, there is fatty liver, stones in the gallbladder, ulcers in the stomach, piles, constipation, colitis, IBS, everything happens. So ultimately, such a person will need lot of money for the existing medicines, money for regular hospital visits, money for insurance, money for regular tests, and money to deal with the side effects of these medicines by taking more medicine. And there will be new diseases also. So ultimately, entire family's income, financial talk will be about you know hospital and how to spend money, how to get best out of any hospital and all that thing. So medicines are not safe in this way. If one person in a family develops this kind of behaviors, dependence, addictions, and side effects, it affects entire family. The children will also develop similar mindset. I call this the medicine mind. Okay, the mind that does not realize that it is dealing with so many issues. And there is no cure for the side effects. The science and medicine, research and everything, technology, they are focused on just symptoms of existing diseases, known diseases. Side effects are still not at all researched. Side effects are still, not at all understood. So how will you cure those effects? Once those happen, how will you cure those, right? And I'm not talking about only allopathy medicine. It applies to homeopathy medicine, Ayurveda medicine, even your home remedies. If you are doing some home remedy every day mindlessly, that also leads to such effects eventually. So what to do now? I may be only scaring you. It may look, but that is the reality. That is the fact. That is the matter now. Don't pop the pill whenever you have any uneasiness. Instead, ask yourself, what is it wrong? For example, if you have acidity, do Kunjal Kriya. Very simple. Drink water and vomit. Study about it. Read about it. Find the videos about it, when to do, how to do it. And ask yourself, why did I get acidity? If it is coming again and again, you are the disease. You are the acidity, not the stomach. Similarly, whenever you are having some discomfort disease, ask yourself, what is it that I did wrong? And look at the body. See what is it asking. Whether it is telling you not to eat, to rest, to get out of the home, to sit in sunlight. Do that thing so that it will be, comfortable now. And if you change that behavior, the disease frequency, intensity, duration will be less next time. And like that, over a period of time, it will go on reducing. But if your disease really needs some kind of support, if your medicine is absolutely necessary, go for home remedies, go for yoga, go for fasting, go for change in diet, then go for herbals or first homeopathy. Then it is absolutely life threatening. You are on the verge of death. Then go to hospital, go take allopathic medicine. No issue there. But you cannot continue that habit forever, right? Like these medicines are not safe. They destroy your entire life. Just like schooling makes you think that you are intelligent. Just like the temple religion makes you think that you know something about life. But except talking all those meaningless phrases, doing all those things, it has no inherent meaning or value. Similarly, the hospital mind, the medicine mind, supplements. If you go on taking supplements thinking that they are good, they cause digestive discomfort, they cause nutrient overload. Our body absorbs whatever it needs from the food. But if you take supplements, they'll cause overdose, right? So all these things are there. There are very specific side effects. Each medicine has at least 100 side effects, minimum 100 known side effects. And I will say each medicine has millions of side effects. As a pharmacologist, as a scientist, as a person who has done, drug research, every medicine is a poison. That's why they are given in such a small, tiny size. They are very, very, very poisonous. They are not safe. Their color, their shape, size, design, and normalization by people makes you feel that very good. They are just dispensed, just like this. You can just go and ask, and they are giving everywhere. It makes you feel that they are safe. No, not at all. Take care.